I'm surprised by the question just because this has now been around for quite some time, and I hope people understand that people may have the notion that we're taking their freedoms away, but the reality is there are laws on the books that in the course of a disaster, an emergency in this state, that the job of our government is to step in to try to reduce the disaster, to try to save as many lives as we possibly can. We've limited the kinds of mitigations that we've put in to the things that will actually have an effect on the virus, or at least on the number of people who will get sick from the virus. And we've even adjusted them over time to make sure that we're taking into account that certain things we've learned over the last 9 months would tell us that you can keep certain kinds of retail open at a certain capacity, and that they're unlikely, or it's less likely, lower risk that people will get the virus from that situation. So look, it's science and facts. And I hope that when we put the science and facts out there, and we have throughout this, you've seen the doctors standing here, you've seen the studies that we've put out, you can read for yourself online or otherwise why those mitigations have been put in place. And there are people who don't want to believe them and want to say that we're taking their freedoms away, but that's not at all what we're doing.